What does an EMG reveal about myopathy? Imagine trying to listen to the electrical signals your muscles send and receive. That's what an electromyography test does. It helps doctors understand how your muscles are functioning. When it comes to myopathy, which is a muscle disease, EMG can give valuable clues. It measures muscle activity both when muscles are at rest and when they contract. This way, doctors can spot abnormal patterns that suggest muscle problems. In myopathy, EMG often shows specific signs. One common feature is abnormal spontaneous activity. This includes fibrillation potentials and positive sharp waves, which indicate muscle fiber irritation or damage. These spontaneous signals happen because the muscle fibers are not healthy and are reacting abnormally. EMG also reveals changes in the motor unit action potentials. These are the electrical signals generated when muscles contract. In myopathy, these signals tend to be short in duration, have low amplitude, and are often polyphasic, meaning they have multiple phases. This pattern reflects the loss or dysfunction of muscle fibers within a motor unit. Sometimes, in certain types of myopathies, especially inflammatory or hereditary ones, EMG can show myotonic discharges. These are characteristic sounds or patterns that suggest muscle fibers are hyperexcitable. While these features are helpful, it's important to remember that EMG findings alone cannot tell exactly what type of myopathy a person has. They provide clues but are not definitive on their own. EMG is also useful for differentiating myopathy from nerve problems like neuropathies or from issues at the neuromuscular junction. It helps identify which muscles are most affected, guiding where to take a muscle biopsy for a more precise diagnosis. The biopsy can then confirm the specific type of muscle disease, including muscular dystrophy. It's worth noting that a normal EMG does not completely rule out myopathy. Some people with muscle disease may have normal results, especially early on or in mild cases. Conversely, abnormal EMG findings suggest muscle problems but don't specify the exact cause. That's why doctors combine EMG results with other tests, like blood tests for muscle enzymes, genetic testing, and muscle biopsy. In the context of muscular dystrophy, EMG usually shows features of muscle degeneration and regeneration. The small, short motor unit action potentials and spontaneous activity reflected ongoing muscle fiber damage. This helps clinicians confirm muscle involvement and distinguish muscular dystrophy from other neuromuscular conditions. In summary, an EMG reveals electrical abnormalities in muscles that are consistent with myopathy. It helps determine how much muscle is affected, guides further testing, and supports diagnosis. But it's just one piece of the puzzle. Always work with healthcare professionals to interpret these results in the context of your overall health and symptoms. Remember, each person's experience with muscle disease is unique, and personalized medical advice is essential for accurate diagnosis and effective management.